Really quick, we're going to talk about gestational diabetes testing because this is the time of my pregnancy where this comes up, and I want to share what I do for that option, while it's fresh in my mind. I've shared in the past videos that I don't do the glucola drink. I don't do any of the in-office testing. I do a comprehensive week-long tracking of my glucose levels after meals. I want to share this because I think many women don't know they have an option other than the orange flavored or red flavored, whatever color it is now, glucola drink. It is a drink anywhere from 20 to 75 grams of carbohydrates. This is from the pure form of glucose, but the problem is that there are so many other, like a lot of times there's other artificial flavors added. There's often dyes added. It's just, for me personally, it's not an option that I would want to use. My midwife does offer the fresh test, which is a powder form of glucose you can mix with water. It's a healthier version, but I still believe it's like a quick snapshot, and I just prefer to do the 1 week long glucose testing monitor. So this is what I do for 1 week. I will test my blood sugar levels 4 times a day, fasted when I first wake up, 2 hours after breakfast, 2 hours after lunch, and 2 hours after dinner. This is exactly what a diabetic would do to test their numbers to make sure they were maintaining their blood sugar levels properly, either through their diet, their exercise, or sort of medication that they take. So this is actually my mom's. So I did not buy this. I don't know how much they run. I know you can get them on Amazon pretty inexpensively. I haven't actually looked. She has managed her diabetes with diet, exercise, and lifestyle changes, so she still has the monitor to check every so often. But this is hers, and it's very easy to use. You take the finger prick. It has needles you can change. Prick your finger, take a strip, you insert the strip in, and it will light up and tell you to apply blood to the machine, and then it tells you your blood sugar numbers after meals or fasted. So I have a tracking sheet if you're interested, if this is something you're interested in talking about with your provider, interested in tracking your glucose this way instead of the quick fresh test or the glucola drink. I have a tracking sheet that I made 3 pregnancies ago. It's just a really quick way to glance at your numbers throughout the day. You could definitely just write this down in a notebook, but it's a free download if you're interested. It's already made for you. I use it for every pregnancy. I send it to my midwife just so she has it on file and we know that everything is good. Told me before that one of her assistants had a concern of, well, couldn't mama just change her diet for a week just to do the gestational diabetes testing at home? And yes, you could. But I want a comprehensive view of how my body is reacting to the foods I'm eating. So I'm very honest and real on this testing. I guess technically they could change their diet for a week and then go back to what they were eating after that. But my midwife told me jokingly, she said, I know I've been in your home. I've seen what you eat. I know you're not lying on your test. So that's how I test. I'll give y'all some footage of me testing, kind of writing down my numbers, writing down what I've eaten throughout the day. I do write down what I eat just in case there is a higher number. I can go back and think, oh, did I not properly pair protein and carbs at that meal? Because technically, when we balance proteins and carbs and protein, carbs, and fats at a meal, our blood sugar should not spike. There are other things you can do to help manage that. You can drink a sort of a bitter drink before a meal. So that could be an apple cider vinegar drink. I've been drinking beet kvass before meals. Make sure you're properly balancing your meal. So as I was saying, I like to write down what I eat with the number. So if there is a higher number, a higher spike, I can think back, okay, did I not have enough protein with that carbohydrate that meal? So maybe I had too much toast and not enough eggs at breakfast. So that is all I do for gestational diabetes testing. I think that many women don't know another option. I found a midwife's page in New Jersey, and she mentioned that they will have their clients eat 50 grams of a carbohydrate at breakfast paired with a protein. So I know I've heard someone say you could drink a glass of orange juice, and you could, and that would give you that spike, see how your body reacts to it. But I just feel like I'm never gonna just go eat carbs in my daily life. I always pair it with a protein or a fat. So it's not a comprehensive view for myself if I just consumed carbohydrates one time for one snapshot. So this is a much more comprehensive look at how my body is reacting to foods I'm eating. So I was reading this off the article. She's had her patients eat 2 pieces of bread, 2 eggs, half of a cup of orange or apple juice, and a cup of cow's milk. And that gives the 50 grams of carbohydrates needed for the test, but you're also pairing it with the protein from the eggs and the milk. So that's just another option. The glucola drink is something that does bring concern to your mind. Just talk with your provider about what options they will allow. I know I have a friend who did not want to drink glucola, and her OB provider did allow her to bring in the fresh test and do that in office. A lot of midwives offer that option. Mine does offer that option. Or you could also talk about the option of real food, because that's what we're really eating every day. And that's what our body is reacting to every day. We're not going to just typically go out and drink the glucola drink. I mean, I guess technically there are sodas and sports drinks that are probably pretty closely equivalent to the glucola drink, but that is just personally not something that I consume in pregnancy. Many of you probably do not as well. So here I just want to present the other options in case the glucola drink is not something you want to take. I hope this information was helpful and informative to you in your pregnancy, or this is another mama who is pregnant who might want another option than drinking the glucola drink to test for gestational diabetes. It is a serious problem. If it does arise in pregnancy, it can be managed. It's not like an immediate need for baby to be born, but it is something that needs to be managed and monitored if you do come up with gestational diabetes. There are some factors that increase your risk for having it: a BMI of over 30, family history of diabetes or gestational diabetes, PCOS, excessive weight gain in your pregnancy, a sedentary lifestyle, having gestational diabetes in prior pregnancies. This was helpful. I tried to make this short, informative, quick, and educational. Another video coming soon about how I approach Group B strep testing in pregnancy, so be on the lookout for that short educational video as well. Thank y'all for watching. Thank y'all for your support in this pregnancy, and I will talk to y'all in the next video.